In talking to someone about resuming sexual function, I think I would feel more comfortable talking to a woman as opposed to a man. Um, and I saw in the sexuality and spinal cord injury lecture this week, it stated that um, sexual dysfunction in men with incomplete lower motor neuron injuries affecting the sacrospinal segments is over 90%. So clearly that's a huge concern, but I don't know how comfortable I would feel discussing it. But I think that's also because I don't know how comfortable the man would feel discussing it with me as a female clinician. So as a future clinician, if this were to happen, I would feel like I would bring a male colleague into the room with me to discuss these issues with the male patient, just so they could relate man to man. I feel like that would be more relatable as opposed to with me as a female. But as considering sexual intercourse is a normal human activity and a staple of relationships, it's a normal act. And so if the patient didn't express concerns of interest to me, I would probably bring it up myself just by saying, now you're free to resume any normal activities, any housework, any intimacy, that kind of thing. So if I say it in a nonchalant way, as if it's a normal act, I think the patient will feel more comfortable following up with questions that they may have they felt uncomfortable to ask to begin with. And I could also provide them with information. I found an article by the Craig Hospital, and it had a quote, and it said, human beings can experience a great deal of physical damage without losing their sexual desire. People after spinal cord injury can still have a rewarding sex life as they did before the injury, unless you tell yourself you can't. So basically the article just gives information about how to handle different scenarios, and it just gives a positive outlook on how life can still be as normal as possible despite the circumstances. And actually, one of the therapists that I work with now has a book that's called Sex with Pain and Injury, and she said she's actually brought the book into the patient's room and showed them the book, let them look over it, and even let them take it home just to look over it in the comfort of their own home so they'll feel better about it. And it gives them time to think of questions that they may have for the therapist. So I definitely like that idea as well. But going into this week, I would have absolutely said that knowing someone's sexual orientation and preferences was not necessary in treating them, just because we're all human, so we should be treated the same. And obviously there's there's exceptions to that. Like a gynecologist should probably know someone's sexual preference just so they know what kind of education may be necessary, like condoms, dental dams, if oral contraceptives are necessary. So I understand that. And we were actually talking in systems management last week about how one of the risks for HIV is a man having sex with a man, just like another risk factor is injection drug use. So I can understand now how the LGBT community has a higher risk of alcohol and tobacco use as well as STDs. So that I understood the STD portion, and actually in some of the paperwork that we have at the clinic where I work now states it asks to circle yes or no whether you have had a history of HIV or you have a family history of it. So that's one way to know. Well, what really caught my eye in this video was the individual who was pregnant but preferred male, like masculine or gender neutral pronouns, but the healthcare staff wouldn't follow the wishes of that person. They continued to refer to him as a female and using her, she, female pronouns, and that was really uncomfortable for him, and it kind of dampened the experience that he had. So with that in mind, it is really important to know what your patient prefers just so you can accommodate their wishes, build a better patient-client relationship, build rapport, open up paths for communication, that kind of thing. So I think all in all now, after this week of lectures and videos, I do think that knowing someone's sexual orientation and their preferences will allow for a better patient-client relationship as well as just healthcare treatment overall.